Hello and welcome to episode 65 of Tom's Hirschsprung's podcast. I am delighted to be joined by Faye Roberts, and we are going to talk about, well, your story with Hirschsprung's and lots of interesting factors within that as well. Welcome to the podcast.
Thank you very much. It's a
Uh,
pleasure.
Thank you so much for coming on. And I guess we'll kind of start where we usually start, which is by the beginning or at the beginning. So I guess we'll kind of take it from there and yeah, see how we go.
Yeah, bro. Perfect. I was born in 1989, uh, born with Hirschsprung's, diagnosed at 2 days old following the failure of passing meconium. I was blue lighted to Alder Hey, um, across the motorway on blue lights. And my parents will forever tell me the story that they were in an old clapped out Fiesta that kept on jerking its way along the motorway, and I'm knee-gnawing off on the motorway in the ambulance. I arrived at Alder Hey, just short of 2 days old, and they diagnosed me with Hirschsprung's. So following that, I had numerous pull-throughs, a couple of months old, stomas at 9 months old, then another pull-through at 18 months old, then another stoma, then another pull through, then another stoma, and it kept going like that until I was about 4 years of age. Following 4 years of age, there were conversations with consultants over at Alder Hey, not there anymore, long gone. Um, but basically was suggesting I was a lazy child. And actually Hirschsprung's was, I guess it was quite rare back then. We're talking 35 years ago.
Yeah.
Um, I was a lazy child and I'd grow out of it. I was still in nappies. And that went on and on and on until I think I was around about 10. I was approaching 10 years of age. And the lovely new consultant came along. Am I right to name it?
Yeah, we could always take it out if you need be.
He was lovely. Mr. Lamont, Graham Lamont, lovely guy, lovely guy. He came along, took over my care. And it was as if it was life changing. I remember all the tests as a child, um, and the fingers up the bum, and all of that. I remember all of that and the washouts,
Mm.
all of which had no effect whatsoever on me. I was so completely bunged up and impacted. It didn't matter which end they tried to shift it, mouth ways or top or bottom. Nothing was shifting. So they'd do lots and lots of operations, anesthetic, wash it out that way, and then a month down the line, we're back to square one. So that was basically my childhood. Um, back and forth into Alder Hey. Uh, my education was, I was very, very, very rarely there. Um, and I had a one-to-one in school, because obviously I was still in nappies, at the age of 10, 11. Um, still there was, if I remember rightly, we're going back now 20 odd years, so there was definitely the urgency that comes with Hirschsprung's, um, what we call the overflow. Um, and that's the reason for the nappies, really. I had zero control, zero control. Um, and then so around about 11, 12, another clinic appointment. And I remember the words from mum saying, she's going into high school next year and she's still in nappies. We can't manage like this. And I remember the clinic appointment like it was yesterday. And Graham's turned around and said, "Well, let's give her a stoma." So there was two options. There was a stoma or there was another surgery that I'd have to go down to London for. And basically, they take a bit of muscle out of your thigh and put it into the sphincter so that you so the sphincter would start to have a bit more muscle and control, I'm assuming. Um, anyway, we didn't go for that. We went for a stoma. So yeah, at the age of 13, off I went into Old Hay, April the 7th. Remember the date? You'd have to work out the year. I don't know when the year was, but yeah, April the 7th. Um, I went in to have a stoma and it was the best day of my life. So no more sore skin, um, no more wearing nappies, um, because they're really bloody uncomfortable.
Yeah, I can imagine.
Uh, yeah, and so for the first time, I was able to wear knickers. First time in my life as a little girl, I was able to wear knickers. Um, so that was, yeah, life changing. And we thought coming out of Old Hay, discharged 2 weeks later, this is it. Like Hirschsprung's, if you like, is naively, it's gone. We're done. And then the rest of my teenage years, I was literally in and out of A&E with obstructions. And they were anything, at least once a month, sometimes twice a month. It was almost getting to a point where the doctors within A&E would be rolling their eyes to say, back again, back again. Um, and it didn't matter how much lactulose or which way you try to clear that obstruction, they do it and then back to square one a couple of weeks later. So that was pretty much my teenage years. Um, so again, I never really went to school. Or if I did, I'd get to lunchtime, and the fatigue would hit around about midday, and I'd be wiped. I'd be wiped out just from a morning in school. Come on, we don't do anything, do we? Um, and again, it was very much, is she being a lazy teenager? Is she just, um, because again, Hirschsprung's was so rare back then.
Mm.
I think it was very misunderstood, um, not just by, education, but health as well. Now, obviously, I'm over the border, in Wales, so Wales, unfortunately, are on a planet of their own, in terms of healthcare. But yeah, it was so obviously my A&E would have been Wales. Um, and it was really, really difficult actually. And to have that open communication between Wales and England, being older hay, um, it was really difficult. Gladly we're a lot better than what we were, but there was still that lack of communication, that lack of understanding. But yeah, I think we've come a long way, hopefully.
Yeah.
So then in 2017, um, I, had crosswords with my then consultant, who showed very little understanding around Hirschsprungs. And so I asked him, there must be somebody out there that specialises in Hirschsprungs because I can't keep coming to A&E every month with obstructions. Um, and he responded, you find them and I'd gladly refer you. So off I went like a dog with a bone. I actually phoned Alder Hay. I was no longer a patient in Alder Hay, but that's the only contacts I had. Phoned Alder Hay, and they were incredible as usual. And they recommended somebody over in the Royal, and that's where it all began really. So I met the consultant over in the Royal, and I'd written all my notes to go and meet this new consultant in the Royal, my pen and paper, and I thought I'm going to put up a fight here. If they, I've put a really good case together to give me the ace because I'd researched it, and I found that this ace would work possibly. So I'd written it all down, my big case, pile of notes I'd written. Walked in, I was like, I really want this ace. I think it would help the obstructions, the blockages, the constipation, the overflow. He was like, yeah, fine, I'll do it. What? So you're not going to fight me? It's like, yeah, fine. Oh, okay. So yeah, and I was listed 6 weeks later, if that, and having the ace done. The recovery for the ace was quite painful. I remember open wounds, and we're talking 2 inches um, deep because I am a right pain when it comes to surgery and wounds. I dehiss all the time. No stitches will hold it. And surprise, surprise, when I had the ace done, dehissed again. And where they put the Mickey button in, it had actually sunken right into 2 inches into my skin. Um, but the Royal being the Royal, they managed to save it and all was good. Um, we put a Foley catheter in for a couple of weeks just to get the hole solid, and yeah, that was all good. So then we started irrigating um, with the bag first and foremost, gravity bag. Um, and like again, I think because my bowel, whether the cells there or not, we think all that's left in my bowel right now, there are cells, but they don't quite work. So even now, I still back up. Um, so yeah, it was. So the gravity bags were never enough for me. I always needed that push. So again, off I went with a dog with a bone. Looking for alternatives, and I found the Broughton Erie pump, on which I've had that for, gosh, it must be 7 or 8 years by now. And that works really, really well. Um, so initially I flush twice a day, I think it was. Um, However, that's now gone to 6 times a day, but I'll come to that why. Uh, so yeah, the Brawny Ripple is really, really good. However, they've discontinued it, and we're on the hunt for another one. I'll come to that.
Okay.
Um, so yeah, so that's what I use is the Brawny pump, and it works really, really well. I might use a bit of lactulose once a month, possibly, just to give everything a push from the mouth downwards. Um, yeah, so in terms of Hirschsprungs, that's where we're up to.
Nice.
And then so where it went all a bit Pete Tong, literally, in 2019. So prior to that, we had been trying for a baby. Sorry, me and my husband trying for a baby, for about 18 months, 2 years. And my husband has got a spinal injury prior to this. So we had gone to gynae and we were awaiting a fertility appointment to see where we lie really. Anyway, lots of tests, scans. I had a gynae consultant look over me, did more tests, did more scans, and we discovered that we had my fallopian tubes were blocked. So arguably, is it all due down to the surgery as a child from Hirschsprung's? Who knows? Um, so again, because I was over in Wales, the Wales consultant of gynae refused to touch me because I was too high risk with all the adhesions. Um, Point blank refused. So he referred me over to England, who is a specialist hospital. I probably won't name it, but you can probably guess where. Uh, and we saw a gynae and fertility specialist consultant, um, who was quite blasé, I want to say. And I quote, I can remove fallopian tubes all day long. You'll be fine. Okay, great. I had quite good confidence in him. Um, Again, listed. I was in about 6 weeks later for my fallopian tubes to be either removed or clipped. So they can be clipped but remain in place, but as long as they're clipped both ends, the the toxic juices, if you like, can't transition into the womb. So we did that. We went for the surgery. I had the surgery on the Wednesday. We verbally agreed that he would go in keyhole at the top, just above my rib cage. And if he couldn't really see anything because the surgery was not a necessity, we would abandon. Anyway, he did keyhole, couldn't see anything, but because we had the colorectal surgeon with us in theatre, he decided to cut me open, hip to hip. Um, he it was documented that he had removed both fallopian tubes. That was on the Wednesday. And then by the Thursday, I started to have high temperature, fast heart rate, typical signs of sepsis symptoms. My mum being a nurse, she came in and she was like, "Oh, you don't know not very well." I was like, "No, I don't feel very well." And then physio came. Now, as somebody who's been in and out of hospital, had, gosh, so many operations that I can't even begin to imagine how many, lost count. I know full well that you need to get moving. You need to get out of that bed and you need to get moving. The quicker you do that, the quicker you can get home. And your recovery will be so much more quicker and smoother. So, physio come along. Do you want to go for a little walk up the wood? Yeah, great, let's go. Um, I'd literally taken 5 steps out of the room up towards the nurse's station, and I will never forget it. I just thought I literally can't even take a step more. Like one more step, I can't do it. I'm gonna pass out. And I never experienced such what would be the word? That feeling that you're so unwell. Never experienced it to that length in all my life. And I just thought something's not right here. Something's really not right. Um, and so obviously they shouted for help. They got me back on the bed. Again, typical sepsis symptoms, heart rate through the roof, blood pressure on the floor, temperature 40, you know. Um, Days went on. My mum came in to see me on the Friday. Now, me and my mum are really, really close, really close. And I would never dream of swearing at her or shouting at her, or we probably never even had cross words that I can remember. Anyway, on that Friday, she came to see me and she was stood in front of the window. The window was open. Uh, and I told her to F off out of the window, off the way of the window, because I was so hot with the temperature. Um, and I think my mum was like, "Oh, she's never done that, um, ever." And you think, "Oh, have I just said that?"
Yeah.
But it was out,
Yeah.
Um, and again, I just thought, I'm really not well, really not well. So they sent me over to another hospital for a CT scan, um, to rule out a hematoma or an injured bowel. Um, on the scan was noted that there was a strong possibility of an injured bowel. That's what it looked like, rather than a hematoma. Um, and then sent me back to the original hospital. Now, the original hospital has got no ITU. Um, they specialize in what they specialize, but that's it. So they haven't got the resources, they haven't got the facility to rescue poorly patients, basically. So I was sent back over. That was on the Friday afternoon. Again, so by Saturday now, I'm really poorly. Typical sepsis symptoms. Um, there was My husband can only describe it as bright green, luminous vomit was coming out of every single hole that you can think of. It was coming out. Um, so down below, out of the wound on my stomach, I was vomiting it. I was vomiting feces that I'll never forget.
Yeah, I can't imagine you'd forget that
Just putting
fairly
that out
quickly.
there. That was not great at all. That was not my finest hour. Um, yeah, and when I vomited the feces, I was like, I'm in trouble. I'm in big, big, big trouble. And I was almost drifting out of consciousness as well. Um, but I refused to get on that bed. So, to give a bit of context, I absolutely hate hospital beds. They're disgusting. They're sweaty. They're hot. They're really uncomfortable. Um, I absolutely hate them. So I will sit in a chair any day over a hospital bed. So yeah, all this bodily fluid, whatever it is, was pouring out of every single hole it could think of. Rage and temp, blood pressure was down on the floor, all the rest of it. Typical sepsis symptoms, in and out of consciousness. Doctors coming to see me, anaesthetists coming to see me. Um, so there was basically a bit of a delay in getting me back over to the specialist hospital that, has an ITU facility. In the end, I was rushed over by ambulance on Saturday night. Um, the consultant came down to see me on the triage ward, and apparently I mean, I was out of it, I was gone by now. Um, he had phoned up theatres and said, "Get ready because I'm running with her now." So my poor husband was like, "Oh my God." It was very dramatic, possibly rightly so. Uh, Ran straight to theatre with me, and they actually discovered I had necrotizing fasciitis. So necrotizing fasciitis is like the top end of sepsis, and it basically the the infection eats away at your organs, your muscle, your skin, eats away quite quickly. There is a very, very small time frame that you either cut away all of that bacteria, the dead bits, or you're going to die. Basically, that's the nut of it, really. Um, they have said if I was another half an hour, it'd been game over. So they operated on throughout the night. Um, Literally they cut me open from hip to hip, top to bottom. I was cut. Um, I was brought back to what we call POCU, post-operative critical care unit, um, and on a ventilator till the Monday, I think it was. Back and forth to theatre as well, just to check that the necrotizing fasciitis wasn't coming back or it wasn't regrowing. Um, so yeah, back and forth to theatre from the critical care unit. Um, yeah, it was a horrendous time, horrendous. I think family and friends still talk about it now in the sense that my poor husband spent, 3 or 4 days literally crying. He had not stopped. Um, and we joke about it. We've got to joke about it, and we've got to find some humor in it because if I'd have been able to, if I wasn't ventilated, I would be saying to him, "Will you pack it in? Stop blubbering. Just pack it in. Get a grip." Because out of the two of us, mentally, I've got more resilience, shall we say? Which I think is, it's probably it's saved my arse more than I care to, yeah. Um,
Wow.
yeah. So once I was brought off the ventilator, I, as they were, lowering the levels of the sedation, I could hear my husband blubbering and slobbering and making a right holy show of himself, as I always say. And then I could hear my sister saying, "Well, this is a fine way to lose some weight," because they had literally cut it all away, taken it. Um, so yeah, it was I can hear it, you can hear the conversations, but you literally cannot move. Um, so as I was coming off the ventilator, I just wanted a hug. So I lifted my arms to hint for a hug, and the nurse was like, "Oh, she's gonna reach and pull the thing out of her mouth. I'm gonna put her back under." And I'm like, "Bloody hell, no! I'm not gonna pull it out. It's fine." So yeah, and I can see her at the corner of my eye, pushing the button. Good night again. So yeah, another day went by, and then again I was properly taken off the ventilator. And I think that's when I realised the extent of the trouble that we had been in. Um, and certainly wasn't out the woods, but it was looking a lot better than what it was. Family were called in on a number of occasions during that week. Yeah, it was touch and go on a number of occasions, really. So yeah, that was it was really, really hard. Back and forth to theatre every single day for about 6 weeks. And I was literally, when I say I was cut open from hip to hip, top to bottom, there is no skin there. So they literally put a piece of cling film, it looks like cling film, over your organs, and you can see your organs. That's
Wow.
it. Yeah,
That must be bizarre.
yeah. But I had no pain. I had no
Wow.
pain whatsoever because they've cut all the nerves away.
Oh,
Yeah.
wow.
So it was like that for months on end. Every single dressing they could think of. Then they brought out the where he'd injured the bowel. They had brought that out into what was a jedge. So if I had a cup of tea, it came straight out.
Oh no.
Yeah, and obviously trying to get a bag to stick when there's no skin there. Yeah. So then as weeks went on, um, things started to heal ever so slowly. This took weeks and weeks and weeks just so you can get a bag to stick on that jedge where they'd cut. Um, so then they decided, well, everything that comes out, if I have a cup of tea, it's coming straight out. So they decided that I need to go on TPM. So yeah, off I went back to theatre and had the Hickman line placed and TPM. I was during, I think it was the last week of November. So I've been in hospital, what, 2 months now. Um, I begged and begged and begged just to go home. I couldn't mentally. I was done. I couldn't, and I'd spent, 8 weeks fighting for my life, but mentally, it was at this point where I was probably the worst. Sleep deprived because, we don't sleep in hospitals, do you?
No, never.
Um, and I think I was just sick and tired of being poked and prodded. If it wasn't the Hickman line, it was my skin or lack of, and things were starting to grow back. And when the nerve cells are starting to grow back, it's really quite painful. And no painkillers really were touching it. So yeah, mentally I was not in a good place. So I begged and begged and begged, let me go home, let me go home. They're like, oh. So anyway, they did, and I lasted 5 days. Not bad, not
That's
bad.
okay. That's okay.
Uh, and on the fifth day, I remember, well, I'd been vomiting and just generally feeling very unwell, and deteriorating quite quickly. Um, I remember messaging my mum, who was happened to be on a cruise. I mean, of course she was.
Nice.
Yeah, I think I've got norovirus. She's like, oh, bloody hell, Uh, never thought anything of it. Then the next day, my husband couldn't wake me up. Turns out I had sepsis in the line. So yeah, quite poorly in bed. Uh, couldn't wake me whatsoever. Ambulance crew came, couldn't wake me. So yeah, blue lighted me to a completely separate hospital. So not Wales, but it was England. But they had zero notes, no history because I'd never even been there before. Um, so the ambulance crew wheeled me into recess. Now normally family get ushered into a room, don't they? And, take a seat, we'll come and see you in a minute. Because of the medical history and it was so complex, my husband said, the paramedic said, you're gonna need him in recess with you to explain all of this. So for the poor husband, he was like in the middle of this recess, everyone's running around. There's like, 10 doctors and nurses together. It was just chaos. All working on me. Now they sent me for another scan and they thought I had pelvic collections that were sepsis. not the Hickman line. So they continued to flush medication through the Hickman line because my veins everywhere else in my body were collapsed. Um, so they continued to use the Hickman line, and obviously, if anybody knows, they're basically flushing around the infection, around in your bloodstream, round and round and round. Anyway, so I ended up in ITU. Um, I was there for about 2 weeks, wasn't improving really. Um, every time I ate, it was coming straight back out because that jedge is still there. Um, every time they were flushing or using that Hickman line, I would get a high temp and those sepsis symptoms will come back again. Um, anyway, so they eventually moved me onto a ward. Anyway, um, and there was just something inside me that I thought, if I don't get back to the initial hospital, the one that saved my life, I'm gonna die here. Um, So again, begging my husband, begging my mum, get me in that car and get me back over to the hospital. Um, and they wouldn't. It was really difficult. So in the end, I have no idea how I found the strength to do it, but I phoned the gastro nurses, the specialists, and said, I think I'm not a doctor, I'm not a nurse, I'm not trained. I think it's my Hickman line. It's not been dressed for nearly 3 weeks, so it was literally hanging out. Um, I think it's that. So the gastro nurses were like, well, if you can get over it, we'll sort it. I was like, right, fine. So I literally knew my husband was coming in to see me. I walked to the main entrance, stood there until he pulled up, got in the car, and he was like, what the hell are you doing? And I was like, drive to Liverpool now. I don't know how I did this because at the time I was very, very septic, very poorly, actually. And I think there is something in you when you need to fight for your life, you fight for your life. Um, and I'm a big believer on it because there was definitely something. It was just an indescribable feeling of you've got to fight. And I can't like quite articulate it, but I can't really put it into words. There was definitely an underlying urge or feeling or
Definitely. I think there are,
something.
yeah,
Yeah.
there are a lot of people who will either sympathize or empathize with you there.
Mm,
I think, again, probably saying exactly the same thing as you, that you can't put your finger on it,
yeah.
but there is a feeling where you go, I'm in trouble here,
Yeah.
and if I don't do something, if I don't fight, I'm going to be in a worse position.
Yeah. Yeah. Absolutely. So off we went over to Liverpool. They took one look at me. They cleaned the Hickman line. They flushed it, and then I felt all right actually. I said Neil, husband was a bit like, "Oh, should we go back to the other hospital?" And I was like, "No, no, absolutely not." So I went to the ward that I had been spent 8 weeks on just to say hi. Uh, and it was, for a couple of minutes, it was lovely. They offered me a chair. Um, and then the next thing, apparently the colour just went straight from me. I vomited in the nurse's station.
Ooh.
Take that as a win. Sorry. And they were like, "Oh my God, you can't go back to the hospital. You need to go back through A&E and come back in." So off we did. Um, and yeah, lo and behold, it was an infection in Hickman line, and sepsis again. So they kept me in. I was in then over Christmas. And I had day visits. I came home to see the dog. I had McDonald's chips on the sofa.
Mm.
Yeah, it does wonders for your mental health. Cuddle with the dog. I went back. And we did that for about 6 months. Um, just back and forth really. And I need nobody else was like, why don't you just stay in hospital? No. And I can't emphasize that enough that having that break, getting out of the four walls, whether it's going to Costa and, having an ice drink, whatever, it's going to come straight back out anyway, but you know, just something of some normality, does wonders. So yeah, in over Christmas, with a couple of day releases, I'm back again. Um, I was on about 5 different antibiotics at that point, just to try and clear the infection, all IV. We got there in the end. Again, I'm still quite open, hip to hip, top to bottom, but it is healing ever so slowly. Um, and then I was like that until October 2020. So we're 14 months in by now.
Mm.
Um, and we were due to go back for surgery for the reconstructive surgery. So to close that jedge, um, release all the adhesions, just basically tidy it all up because it was an absolute mess. Just before they did that reconstructive surgery, they did another MRI scan, and it actually discovered that my fallopian tubes were never removed. Uh, yeah, it's a tough pill to swallow.
It's a
Um,
bombshell.
Yeah. And actually, there was a high risk of having to have a hysterectomy during that reconstructive surgery. So back to the very initial specialist hospital for 2 rounds of IVF fertility preservation. So I'm on TPN, I'm on antibiotics, and now you're going to throw me on IVF. I did it, I did it somehow. Um, so I've got all these, yeah, it's unbelievable. It
It's
is
mad.
unbelievable. It is.
It's
It,
mad.
it is. And I guess what you can throw at the body, and the human body keeps on taking it and taking it and taking it. And here I am. But yeah, so surprise, surprise, we had really low numbers from the IVF. Um, we had 3 embryos in all, but they were put in the freezer. It was sort of put to bed because we're in no position to follow that through right now. Um, and then literally a week later, off I went into back into hospital for the reconstructive surgery. Um, and unfortunately, we just hit COVID, so no visitors. So I went through that all by myself. And the morale in the hospital was, Jesus, it was horrendous. It was absolutely take my hat off to them. Um, Yeah, horrendous. So I had the fertility preservation done, I had the reconstructive surgery done, and I didn't have hysterectomy, but they managed to remove one fallopian tube, but they couldn't get to the other one because it was just so mangled in adhesions. It was such a mess in there. And so it wasn't clipped either. So one is remaining and unclipped, and one is out, gone. But it's a mess. Absolute it's a shit show in there. So recovered from that, and then and I'm off TPN. So we thought, great, right, life can sort of get back to normality now. Naively, we thought we were done. It's all done and better. I just need to recover type thing. It's all good. And I meet him, which was huge. And do you know what? I take my hat off to, and I envy anybody who's on TPN for life because food is such a massive part of our culture, our identity, socially. It's food's everything, isn't it?
Yeah.
I am a big foodie. So yeah, the life on TPN is really, really difficult in every way. So when they did the reconstructive surgery and they put everything back together, and they said you can eat, great. So New Year's Day came along, and my mum said, let's do a big buffet. I was like, yes, food, proper food. Uh, and so potentially, did I overeat? Maybe. The next day, I woke up and I thought, I'm in a lot of pain, but I couldn't quite figure out where it was coming from. And then, so as the morning progressed, got to about lunchtime and an overwhelming, quite urgent feeling to vomit. So went to the toilet, vomited. And on the way back from the toilet, I collapsed in the hallway, um, with horrendous pain. I thought I was having a heart attack. I was convinced. So the pain was radiating up to my chest, down to my arm, into my jaw. Um, and when I'm lying on in the hallway thinking, Jesus, I'm only like 32. Honestly, I thought I'm going to pop my clogs with a heart attack. I've just been through all of that, injured bowel, necrotising fasciitis. It's going to be a heart attack that sees me off. So, yeah, husband calls an ambulance again, and off I go into A&E, prime COVID time. I
Yeah.
was literally in majors with COVID patient next to me, COVID patient next to me on that side, and a COVID patient opposite me. And I am diagnosed with acute necrotic pancreatitis.
Oh,
Yeah,
wow.
very, very painful,
Yes.
agony. Um, and again, apparently you can be quite poorly with pancreatitis. Um, we'll never quite know because I then caught COVID.
Oh,
So yeah, so I had pancreatitis and COVID at the same time. So we'll never actually know which was causing more symptoms than the other. Um, so yeah, following that, I've sort of recovered enough. I think I was in about 2 weeks. Again, no visitors whatsoever. Prime COVID time. Um, recovered, sent home with the referral going back over to Liverpool
right.
for the pancreas specialist to see me in clinic. Saw me about a week later in clinic, and I remember this look on his face. He was like looking at the scan picture on his computer and looking at me, and he was like, that does not go.
Oh, dear.
So I had lost 75% of my pancreas, and the tail of the pancreas had disconnected. So the picture of the scan looked horrendous, but yeah, I was walking into clinic. And he was like, "What?" And I did say to him, I don't feel very well. I feel quite poorly.
Yeah, I can
Uh,
imagine.
he was like, right, you're coming in. I was like, oh no, 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 no. I've spent far too many months of my life here. No, 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 no. He was like, you're coming in. Hmm. So yeah, uh, so that's where I went, but back up to the ward. They did numerous uh endoscopy procedures. In the end, they put a stent in into the pancreas, between the pancreas and the stomach, so that all the bacteria and the juices of the pancreas can flow into your stomach rather than building up.
Yes.
Because it's collected so much um of dead tissue and bacteria, it was squashing my stomach, so I wasn't able to eat. It squashed my stomach to be tiny. Um, so yeah, I had that done, recovered all right from that. Um, and then I went during the summer of that year, so we're now 21. Um, I don't know how I did this, but I completed my last year of my social work degree
Wow.
placement.
In
Yeah,
between all of this,
all between,
you're doing
yeah,
a social work degree.
no idea. No idea.
No.
Um, I remember days, and there were more days than not. I slept on my desk, lit, keeled over, just recovering really. I mean, I'd thrown so much at my body, and I think I was knackered. I was absolutely knackered. Um, and then yeah, it was really, really hard, but I did it. I got through it. Don't know how, but I did.
Yeah.
Um, and then October 21, I went back in, had my gallbladder out. So just to give a bit of context, it was the TPN caused the gallstones, the gallstones caused the pancreatitis, and so the
Yeah.
gallbladder needed to come out.
Okay.
So gallbladder was out, um, October 21, and we thought, right, okay, surely that's it now, you know. Um, recovered from the gallbladder coming out, and again, it was an op, it was still an op, but recovered quite quickly. So in the January, where are we now? 22. We thought this is the best I'm going to be. Let's defrost those little embryos that we made and try and implant them and transfer them into me. And so we did that. We did 2 rounds, and then we realized that there was still fluid within my womb. So the only way that fluid was in my womb was because of that one fallopian tube that was unclipped. So this, I think we're about early spring now, and that worst clinic consultation that I've ever had in my life, um, PTSD level,
Yeah.
with the words, "You will never be able to carry, you will never have an embryo survive in that womb." Um, Basically, give up now.
Wow.
You won't ever have your biological child, and you certainly will never be able to carry a baby to full term. Um, yeah, that was horrendous. Probably the lowest I've ever been.
Yeah.
Um, Obviously, I went off sick from work for about 6 weeks just to get my head around it. Lots of therapy and counselling, and
Yeah.
um, yeah, just to get my head around it really. They refused to do another egg collection because of the risk of the adhesions. It's just a mess in there.
Yeah.
So I'd never have biological anyway. Um, so my sister offered to donate her eggs. And unfortunately, we only had one embryo from that round. I mean, she's 5 or 6 years older than me, so scary how your egg reserve diminishes over 4 or 5 years. It is frightening.
Wow.
Um, yeah, anyone listening to this who thinks they've got all the time in the world to have, a baby, perhaps look into it. It's not the same for everybody, but it is frightening how quick that diminishes at the time you're 39, 40. It's
It's
frightening.
worth knowing though, I guess.
Yeah, absolutely. In my naivety, I was like, oh yeah, we'll be fine.
Mm.
It's no problem. So we tried to implant that embryo, the donated one, uh, into a surrogate, and unfortunately that failed. So yeah, we're back to no embryos.
Okay.
Um, Still in the pipeline, but you get to a point where you think, is there something or someone telling you just to stop? Just stop.
I, I, I think it's I think it's difficult to think like that, isn't it? It's
Hmm.
difficult to, but totally natural to
Hmm.
go. This has failed. This has failed. This has failed. Is it a universal sign? But depends what you believe in and how you believe, I guess.
Yeah. Um, and every doctor I speak to, and they go, "What, you've survived necrotizing fasciitis?" Yeah, yes, I have. Um, so in that sense, I'm the luckiest person to survive that, but so incredibly unlucky to have necrotizing fasciitis, necrotic pancreatitis. Normally they don't go together.
Yeah.
Um, so yeah, really, really difficult. 5 or 6 years really. Um, so complications from all of that. I mean, naively, I thought, I'd recover from each of these things. We'd get there in the end, but actually, I have chronic pancreatitis. I have delayed dumping syndrome. Basically, your pancreas releases the sugar, the insulin, and doesn't match the time that the food's reaching your stomach.
Hmm.
Um, so it presents like hypos. Now my hypos are quite significant. They're twos, low threes.
Yeah.
So at the moment, unable to work. Too high risk apparently. Um, to work. It's really, really difficult. Um, bile acid malabsorption, the fatigue that's come through from the past 5, 6 years. Um, yeah, it's
Yeah.
it's a bit of
Wow.
a mess.
That's such a fascinating story though, and I have so many questions and so many things to ask you. Um, but I guess one of them would be, I know you talked about the strength of the human body and human mind. Did you surprise yourself at just how strong you are physically and mentally?
Yeah, absolutely. I mean, if we go back to being transferred from the initial hospital over to the second hospital on that Saturday, when they wheeled me into the lift, I had this overwhelming feeling of I am in a world of trouble here. Um, but you're too sick to even verbalize it. Does that make
Yes.
sense?
Kind of paralysis as such.
Yeah. And you lie there and you think, and you something inside you is almost begging that the health system or saves your ass, literally.
Pretty much, yeah.
Yeah, saves your ass big time. So yeah, there were a number of occasions where I thought, this is it, this is it. Um, and then there's a rush, whether it's adrenaline or what, I don't know. Kicks in and you literally fight for your life
Mm.
without physically fighting for your life
Yeah,
because
yeah, I know what you mean.
you know what I mean? You're too sick to physically fight, so you mentally fight.
Yeah.
Does that make
Yeah.
sense?
That makes absolute sense. And I'm sure there's a lot of people listening who will again resonate with that and
Mm,
think, yeah, I know exactly what you're talking about. There'll be some people that go, I haven't got a clue what that
yeah,
means. But that probably because they haven't necessarily had to go through
yeah.
what anything like what you've been through and luckily for them. But no, I do. I get exactly what you mean with that as well. And I know you mentioned your husband and how supportive he's been in terms of how many times he's called an ambulance and this, that, the other. I mean, how, I guess, putting it in your own words, how supportive has he been to you?
Absolutely. I probably wouldn't be here without him.
Ah,
Yeah, both physically and mentally. Um, we had only just got married in 2019 in the summer. So our whole married life has been, he's not really my husband, he's my carer.
right,
And how those dynamics change, um, the dynamics change with your friends, your family, husband, wife, whatever. Um, when something like that happens, it is literally life changing. Um, and I guess you need a lot of therapy to try and process all of that, really.
yeah, huge,
Mm.
huge. And the therapy itself, how beneficial was that to you?
Do you know what? I'll put my hands up. When my GP initially referred me to community mental health, generally very low mood. I was having nightmares pretty much every night, waking up sweating. Um, Daily, I was having re-seeing POCU, which is the post-operative critical care unit. Um, I was re-seeing the events that unfolded there, which were horrendous. Wouldn't wish that on my worst enemy. So I was diagnosed with chronic PTSD. I had well, the flashbacks were actually POCU was a four-bedded room, and there was no windows, so you didn't know whether it was day or night really. Um, the only realised for me was the shift changeover.
Right.
That was the only way that I could vaguely figure it out. Um, so the other three beds, obviously, there were people ventilated, and I thought they were all dead.
Right.
But I was and I thought that the nurses thought I was dead.
Okay. Yeah.
Okay,
Yeah.
but I
Got it.
wasn't. I was I was definitely alive. I remember leaving the other hospital, and the next thing I knew was I was in this POCU. Um, but I am alive, but they don't. But they think I'm dead. So yeah,
Wow.
yeah,
Trying to process that is mind-boggling.
yeah. Um, and if I don't make them realize that I'm alive, they're going to push me to that fridge, and then I'm going to die in the fridge. So that's when you talk about mental resilience. there is that an overwhelming urge to fight. And I was an absolute pain in the arse patient because I thought if I wasn't a pain in the arse patient, I was going to end up in the fridge.
Right.
So and you can't get out of this bed because they've got these stupid railings up, so you can't get out. It's about 90 degrees up there, absolutely sweltering. And it didn't matter how many times I said to the nurse, "What happened? What's going on?" I must have asked her about 50 times in the space of a shift, bless her. Um, so when she went on a break, another nurse was looking after me. And do you know the pain button that you give him?
Yeah. Yeah.
I was bang,
Morphine?
yeah, I was banging that on the railings of the bed. And I did that all night long and all day long because I thought if I stop banging that, they're going to think I'm dead.
Oh God.
I was, I was a nightmare.
Yeah. Yeah. I mean, yeah, I won't lie.
Sorry.
That sounds like a nightmare.
Yeah. So then when they obviously that 24 hours, you had to stay in pocket because they'd given me a drug, um, that they'd asked my mum what's my pain threshold like, and mum had said, terrible, give her everything under the sun. But obviously it sent me
Yeah.
wherever they gave me. I don't know, I think it was ketamine, but we're not sure. So once I'd come down off that, they then sent me over to HDU. Um, and the transfer from POCU to HDU, again, I was convinced I'm going to the fridge. So bearing in mind, I am cut open from hip to hip, top to bottom. I decided the only way to make sure they know that I'm alive in my ketamine brain
Mm.
was to stand up on the bed.
Oh.
Literally moving down the corridor, I stand up. So they're like, sit down, lie down, get back on the bed. I'm like, no. And I remember the porter looking at me going, just carry on, because they only had to turn around the corner and we were there. So I'm stood up on this bed, cut open from hip to hip, top to bottom, no pain because I'm off my face on ketamine. I'm not going to the fridge. Please don't take me to the fridge. They're like, what? What?
Oh.
Yeah. And then once I was in HDU, I thought they were still trying to kill me. I was gonna die. I was still gonna end up in the fridge. I even thought that my husband had like a secret camera up his nostrils. I was absolutely off my rocker on
Yeah.
cat. It just, yeah. Um, and that's where the PTSD comes from. It was
Got
that
it.
36 hours of POCO and HDU. Um, so yeah, so when I had therapy, they referred me for EMDR, which is the rapid eye movement therapy. You basically follow a light and it goes faster while you're replaying the trauma.
Right.
And when they first referred me, I thought, this is going to be a load of, this is not going to work. Absolutely changed my life. It was a
Wow.
hard, hard 16 weeks of
Yeah.
therapy. Um, there were sessions where I thought, I can't do this today. Can't. And I did, I carried on, didn't miss a session. And by say week 12, flashbacks had completely stopped. The nightmares
Wow.
had completely stopped. There was nothing, nothing. I
Amazing.
can go back to that memory now and I'm fine.
That's
I've got
amazing.
I've got no physical reactions to it when I describe that memory or that time. I'm fine. Um, but yeah, those nightmares have they were finished. It was gone. After about week 12. So yeah, highly,
Wow.
highly recommend EMDR. Highly recommend it.
Yeah.
Um, and
That's
counselling,
fantastic.
to process, unable to carry a child and not being able to have a biological child. Lots of therapy and counselling. Um, I'm in a completely, completely different place to where I have been in parts of the last 5 years.
That's brilliant. No, that's absolutely fantastic. And I'm so glad for you that the what the therapy was supposed to do
Mm.
did its job, and that's fantastic that you're in a much better space now. Because as we've sat here and talked for the last hour or so, you have been through the ringer and some. So the fact that you have been able to process that, I think, is amazing, and kudos to you on that.
Thank you. Yeah. Yeah.
But I think just as we wrap up here as well, in terms of the future for you, so you said you're in a much better space now. What would you like the future to look like?
Um, I want a camper van.
Nice.
Yeah. Um, because actually, if anything, the last 5 years has taught me is life's too bloody short.
Mm,
Um, and it could literally be put in the fridge. Game
yeah,
over.
yeah,
You know. Um, so life is too short, and I just think you need to live it. A lot of people say live it like tomorrow's never promised and all of that. But actually I'm a firm believer that it could be. So I would like a camper van. Um, I would like to go back and work with some dogs.
yeah.
Dogs is my passion. Um, I love dogs. So
Same.
yeah, yeah. All breeds, all sizes. Um, I love to see dogs work and using their nose, using their brains. Dogs just being dogs and living their best life, really, however that looks like. So maybe in the future. Um, but yeah,
Definitely. Well, I can't see why not. Be great. But no, I just want to say thank you so much for doing this with me today and
thank you.
for sharing your story because it's been um absolutely amazing. So thank you ever so much, and I yeah wish you all the best in the future.
Thank you very much.